going to be able to point to this and say the NYPD, the Department of Health, Samaritan Daytop, the commissioner, the mayor, the borough president, myself, and the council member, and the assembly member, the next CEO of Samaritan Daytop came out of here. The next CEO, the next NYPD sergeant might have come out of here. We need opportunity for our New Yorkers, and I'm grateful for this administration for continuously providing opportunity. I'm excited about this. Thank you, Mr. Mayor, for the opportunity.
Thank you. Appreciate you. It's clearly important to hear from all of our partners, and I really want to thank Chief Tobin of interagency operations for the NYPD for the job that you're doing. I see you have some of your sergeants and officers that are here. We unfairly treated the New York City Police Department in this city in so many ways. We called on them to do everything. We called on them when someone had a gun. We called on them when someone had a cat up the tree. We called on them when someone was going through a mental health crisis. We called on them for everything and didn't realize that we had other agencies that we should have coordinated with that can properly do the function that we were calling on the police department to do. And that's what we analyzed. We analyzed what can we take off the plates of the men and women who are on the front line of fighting violence. And one area that we zeroed in on was mental health illnesses. It was an indictment on our entire system and city that 48% of those inmates at Rikers Island had mental health illnesses. 48%. Our answer to those who were seeking help was to lock them up and place them on Rikers Island. That is the system that we had. And so when Dr. Fassan came in with his knowledge and understanding of if you create the right environment, then you will borrow from Mel Gibson in Field of Dreams, I believe it was, if you build it, they will come.
That's right.
And so we built it, and they're going to come. They're going to come and they're going to walk through the meditation room. They're going to come and have a place where they can get their medication if needed. They're going to come and get 3 meals, a shower, a place to sleep, just to de-escalate your crises. Instead of having to call the police to respond, and that blue uniform sometimes can aggravate the situation instead of de-escalate the situation. So this is an amazing partnership, and I think Senator Bailey touched on something. Why is it a challenge to house something in the community? A person that's dealing with a mental health crisis, that's your brother, your sister, your aunt, your mother, that comes from your block. And when you say don't build it here, then you're saying don't give people the care that they deserve. We are not going to allow that to happen. And this is an amazing opportunity in the increase and expansion that we put in place to make sure that we create more facilities in taking this forward-thinking approach to mental health crisis, reimagine it. And this is bold, and let me tell you something. The stuff we are doing, you have to ask yourself, why are you placing yourself in harm's way like this? We could do something politically correct. We could ignore the encampments on the subway system. We could say we're not going to engage people and just walk by and it doesn't exist. Because the first week, we only had 22 people that took us up on our offer. Now we took 1,700 people off the subway system because we engaged them. We could have said, let's continue to allow police to respond to calls of mental health illnesses and continue to fill Rikers with those with mental health crises. But we said, no. We're going to double the size of these important initiatives of support and connection. These are bold steps we're taking with pre-existing problems. And then you stop bottlenecking the emergency rooms. It is more costly to wait for someone not getting their proper medication, not getting the proper health care they need, allowing their chronic disease to go into a crisis mode, and then they go to the emergency room and use it as their primary care. That is costing taxpayers dollars. But when you go upstream, you can prevent it from happening. You're giving folks the counseling they need. You're giving them the resources they need and a long-term medical and mental care that they deserve. And that's what we're getting right here in this location. We're going to break the links that mental health and public safety are the same things. They are not. The answer to mental health crisis is not a public safety response. It is a health response. And changing that dynamic is crucial. Mental health crisis is not a crime. It's a crime not to give people the services they need when they're going through a mental health crisis. We are stopping the criminality of people who are dealing with mental health crises in our city. So we're not going to put those who are already suffering in additional suffering in a crisis mode. That's the goal of this partnership that we have developed. And the optimum term is dignity. If you walk through this place, those of you who are staffers here, I want to thank you. You can feel the dignity in this place. You can feel that this is an inviting place to deal with someone when they're experiencing a crisis. And so the officers in the 47th Precinct and the Be Heard teams, we want to thank you for your support. You can bring people here who are in crises and give them the help that they deserve. And we want to also let the Behavior Health Emergency Assistant Response Division, the acronym, Be Heard. It's a pilot project that was launched in the spring of last year. Under our administration, we have more than doubled Be Heard pilot area. And we're not just talking about it, we're putting the money there, $55 million investment. This is a real dollar amount we're attaching to this. And each dollar will be spent on treating mental health crises compassionately. It's going to save us thousands of dollars in the process. And not to mention, it's going to save the heartaches to the family members who are seeking help. You hear it over and over again. Crime takes place with someone with a mental health illness. You hear the family members state it. We try to reach out and get them help. And we couldn't find a place to get them help. It's unimaginable when you see your person, your family member, your loved one declining to the point that they need help, and you can't find that help for them to stop them to harming someone else. That's what our goal is. It's an upstream way of dealing with a downstream crisis. And so I'm proud to be here. I'm proud of our partners that have come together and stated that we can do something different and save the lives of people who are going through a difficult moment. And Dr. Fassan was clear. COVID has traumatized all of us. All of us. All of us know someone that is in our life that is experiencing something post-COVID. And we have to have a post-COVID response. And this health commissioner has really, he has taken a holistic approach, not just checking the boxes, not just going through the motion. He has been thoughtful on how do we handle COVID. And sometimes it's a retrospective appreciation. You look back and say that this was the right person at the right time to navigate our city out of this difficult moment. I'm proud that he's part of our team. I'm proud of his team. We are going to step up to the challenge that's facing us. And we're going to make sure that all of us as New Yorkers come out of it together. Thank you very much. Thank you. Over to any questions to Dr. Fassan, any on-topic questions?
Any on-topic questions? Iona? Sure. Mayor, can you talk a little bit about why here in this particular community in the Bronx, are there particular considerations here? Is it just that the resources were here already? What led you to this?
Well, Dr. Fassan, you could deal into that, but I would say this. I told both the Borough President Gibson, Senator Bailey, throughout my time in the Bronx when I was campaigning, and speaking of Ruben Diaz Jr., who started to move the Bronx in the right direction, the Bronx has historically been denied over and over and over again. And I made a commitment that we were going to spend time here in the Bronx. We were going to look at some of the issues that are important. And we had a list of things that were crucial, and this was on the list. Having adequate mental health treatment facilities. We were in the Bronx over the weekend for high-speed broadband Wi-Fi. We were in the Bronx for our summer youth programs in our schools. We have been in the Bronx over and over again because if you lift the Bronx, you're going to lift the entire city. The Bronx has been denied, and this is not going to be an administration that's denying, and this is one of the things that they talked about, Dr. Fassan.
Yeah, it's pretty simple. Thanks, Mayor. It's pretty simple why we came here, because the South Bronx and the Bronx in general has one of the highest rates of psychiatric hospitalizations in the city. It also has one of the highest rates of incarceration in the city. It has one of the highest rates of 911 calls for mental health crises and emotionally disturbed people in the city. And so along with our East Harlem Center, we wanted to go where the need was the greatest as a start. But, you know, as we build this out, we want to see this all across the 5 boroughs, of course.
Yeah. And, you know, and just to some of the other highest number of traffic issues, fatalities and others, highest number of shootings, highest number of, one of the highest numbers of students that are not reaching proficiency. All of those negatives, are just feeders. And, you know, these electors have been saying, we need help. We need help. And, you know, it's just been falling on deaf ears. And we're just not going to do that.
Bobby, do you have an on-topic
Yeah.
question?
Can I ask one of you guys to talk more about how people end up here? I mean, obviously there's walk-ins, but do the Be Heard teams just refer people, or do they actually physically bring them here? Does EMS bring, and also homeless services? How does that work?
Right. So it's a great question. As we're starting out the gate, it's first responders of different kinds: police, EMS, Be Heard teams, bringing people in. People can also walk in off the street of their own volition. We'd like to see that expand to the subway outreach teams and so forth as that program matures. Ultimately, we want to take people who are directly referred and brought here as an alternative to other carceral or other destinations, but we also want people to feel like they can just walk through the front door and get help when they need it. And so that's really the referral pathway that we're looking for, referral pathways.
Right, because a crisis doesn't impact you on an appointment. You know, crises don't wait and say, listen, I want to impact you on Monday at 3 o'clock. No, it hits you. And you must be able to have a place to go to when that crisis hits you. And so the referral is important. And as Dr. Fassan and I were walking through here, 'cause we're constantly modifying. Dr. Fassan said, listen, this may be something we could do with our subway safety plan. We're in this constant state of how do we build a better mousetrap. That is where we are. And when you're at that place, you know, sometimes people, you know, critique what you're doing, but we're on the front line. And, you know, this administration is immune to being critiqued. we just say, listen, that's just a lot of noise. We know we're going to do the best for the city. And so we're going to continue to shift. And I'm happy the boldness of, you know, the leadership. Yes.
Do you have an on-topic?
Yep.
All right, we'll do Steve and Georgia, and then we can go to Al.
So I have a question about the initial police response that would lead someone here. You know, we had the man in Queens over the weekend who had a history of mental health issues, who ended up getting shot by the police, and you, Mr. Mayor, described him as a bad guy. So where do we draw the line between someone who can come here versus someone who is deemed too dangerous to come here, even if they do have a history of mental health problems?
Well, and Dr. Fassan to talk about that. The police shooting in Queens, when you hear the tape, clearly you're dealing with someone that had a mental health issue, in my belief, and I'm not a medical professional, and that mental health issue had him as being a bad guy. He wanted to do something bad. He wanted to do something harmful. What we must do when people are in that state and go from a law-abiding person to a bad guy, we must be there before they get there, and we must respond when they are there. You cannot tell officers that are responding to someone that had a gun, discharged a gun, and made it clear on what his action was going to do. Those officers, I really take my hat off to them for walking into harm's way that they knew they was about to walk into.
In a dangerous situation like that, is it still possible to come at them with this kind of mental health first response?
I'm going to respond from a law enforcement to let Dr. Fassan respond. I am not going to have city workers go into an environment that we know is going to possess imminent danger. If based on that information that came up through that 9/11, I got to take my hat off to the operators. Based on that information, it would be irresponsible for us to send someone there that is not properly trained to deal with imminent violence. Imminent violence. You know, we're not going to send civilians into harm's way, Dr. Fassan.
I mean, I think your question highlights the challenges we face in our emergency response system with 911, much in the way that the mayor talked about asking police to do a whole host of things. We're asking 911 to be the single dispatch for a whole host of things. And so we're not only does this city have NYC well, but this city will be a leader on the implementation of 988, the federal crisis response hotline. We want New Yorkers and Americans to know that starting soon, they can call 988, get crisis response services, get the kind of health first approaches that we're talking about here, and also get access to all the suite of services offered through NYC Well today. They can call NYC Well, they can call 988. Eventually, over time, we'd like that to be a single number. Now, the other piece here is we're often talking about these places, this social infrastructure as recipients of people, but it's also a preventive. And that's the part that we don't talk enough about. It's the cyclical nature of these encounters between police, law enforcement, the justice system, homelessness services, emergency rooms that we're trying to interrupt. And to break that cycle with this as not just a destination for people and a place you can send folks, but it's a place that will prevent the next crisis. And so the more of this that we have, the fewer crises we'll have.
Dr. Bassan, you mentioned that there's a counterpart site in East Harlem. Just to clarify, are these the only two functioning sites of this kind as of now? And if so, what are the plans to expand them in the future?
These are the only two functioning sites as of right now. The site in East Harlem opened at the beginning of COVID. And so, as you can imagine, referrals were challenging. Getting that site up and going was challenging. It's now up and going, and we're collecting data and learning about it. Between that data and these data here, we'll have a better understanding of its effectiveness, our ability to grow it, and then, of course, get additional resources to expand it. We've been talking actively with our partners at the state for those resources as well. And I know the federal government is also talking about expanding mental health block grant funding for programs just like this. So we're starting here. We'll collect the data, we'll evaluate it, and then move on.
Get one of these. Thank you.
We have time for a couple off topics. Try to keep it to one so we can get to our people. Bobby?
Mr. Mayor, there was an article reported today in Politico about an undisclosed location, which I guess is not undisclosed anymore, in the Verizon building downtown that you use as sort of a secondary workspace. Can you talk about why the need to have this other workspace, what you do there that you can't do at City Hall?
I'm sorry that, we're getting a spike in COVID because I have to wear my mask and I can't give you my signature smile right now. I mean, how do you have a city location as an undisclosed location? I mean, this just doesn't make any sense. Some of this stuff we have to ask ourselves, are we just being creative here? This is a city location. I move around to different city office spaces. Sometimes I need to do a Zoom, and I can't get back to City Hall right away, so I will stop someplace to go. Sometimes I want to do a meeting, and I'm in that area. It could be an elderly across the street in the NYCHA, and she can't come all the way to City Hall. This is a city building. All city buildings are places, OEM. Office of Emergency Management. They have an office there for me with a shower in case there's an emergency. Every space in the city is part of what I utilize to assist the city. So if someone feels as though there's a location that's staffed with employees that couldn't fit in this little small space in City Hall, which they would rather be in, because everybody likes being in City Hall, of that we now have this secret, undisclosed location. That's just not making any sense. I've been in that building 3 times. In the last, couldn't have been more than 4. Because if I say 3, y'all gonna do the math and say, oh, you said another time. So I've been there to look at the space, make sure it was safe for my team. That's there, that's a sign there. So they could be all in one place. It was a smart way of using government resources. My team there is doing real work. I'm not there. I'm at City Hall, so I'm not sure with this undisclosed location. You know what I figured out? I figured out whenever you have Eric Adams' name in the story, you get a lot of clicks. So people just find ways. Hey, he ate fish, clicks. Hey, he did this. I'm just a popular guy to write about. You know what I'm saying? So I got it. So I got to go with it. We got this secret location. It's not secret location. It is a space that we utilize to do work.
How's it different from the work that's done at City Hall? I mean, it's so close by.
Yeah. When we go back to City Hall, I'm going to walk you through the space where I am located. I don't know if you've been there before, but we're going to break the rules, and I'm going to bring you into the space. It's a small space, and my scheduling team, my other team, they can't fit into that small space. So we have City Hall staffers in all of these different locations, many of them. That is one of the locations. And so I'm just really curious on why it's an undisclosed location, because it's not.
We'll go to Steve, and then Georgia, and then I think we'll wrap it up. Oh, go ahead, Steve.
I have a monkeypox question. I want to bring the health commissioner back on.
Yeah.
You have to imagine frustration is boiling over for folks that are trying to get a vaccine. The website crashed for, I believe, the 3rd time yesterday with more vaccine appointments coming out. We had a previous infrastructure to give vaccines out to millions of people, but this infrastructure seems to not be functioning as well as it should. What can you tell these folks that are just at their wits' end trying to get a vaccine?
We apologize for the problems yesterday. We apologize for the problems last week. Shouldn't happen. Take responsibility for it. We're building more stable vaccine appointment infrastructure as we speak, and we'll be announcing developments in the coming days about how New Yorkers can make appointments over a longer period of time. As you know, that's all a function of the amount of vaccine that we have. So I don't want to detract too much from the fact that New York has led on this issue. It's because of New York City that we're even having this conversation about a national vaccination strategy. There was nothing until we did our pilot in Chelsea in June. There wasn't a plan in place. And so we pushed that conversation forward, but we own it. Those mistakes shouldn't happen. And so we're working to correct those and do better for New Yorkers in the future.
When you had that previous infrastructure, why wasn't that used versus this new unproven infrastructure that clearly is not working?
It's a different endeavor. That's a mass vaccination program citywide, which has a massive infrastructure associated with it, and it's doing just about all it can to handle all the vaccination sites around the city, the Vax for NYC app and site. And we're building a similar thing, but it required more space, more infrastructure, and a separate build at this time. And so we're working closely with our partners at the Matt Fraser and the Chief Technology Officer's office and do it to build that out as we speak.
Georgia, go ahead.
This goes back to Bobby's question, Mr. Mayor, but with regard to the offices at 375 Pearl Street, did you ever have those offices renovated for your use?
We said renovated, what, take down walls, build out spaces?
Yeah, like
we built more cubicles. We built more cubicles. What did we do? You move into a space, you modify it to fit. The way it was laid out, that there was very few cubicle spaces for people to sit in. There was a huge conference room. We said, we don't need this fancy conference room. We need desks for people to do real work. So we built out more cubicle spaces for employees to have more desks. It was a brilliant, smart idea, and it just continues to show the brilliance of my administration. Okay, thank you.